Good morning, everyone. So, welcome to episode 3 of Movement Mondays. So, we are happy that you joined us this morning, and we are super happy that you woke up early. You know, diba, if you wake up early, it's always a good start to every morning. And if you start the morning with movement, it's always a good thing. So, for episode 3, we are going to talk about exercises for the Down syndrome population, no? But specifically for today, we are going to teach you exercises on how to improve their core strength. I am Dr. Kaye Napalinga. I am a developmental and behavioral pediatrician at the MedMom Institute for Human Development. And with me this morning is our speaker. So Maryann Morales, or we call her Teacher Maryann, is a physical therapist. So she graduated with a degree in neurobiology and neurophysiology from the University of Maryland. And then she continued on to do her doctorate in physical therapy from the University of Southern California in LA. So Teacher Maryann has been practicing as a physical therapist since 2010. No, she's worked in a lot of schools, clinics. She's done sports science. She's been in sports science clinics, orthopedic rehab clinics in the Southern California area. No, she's a Filipino American, and we are super lucky that she came to the Philippines and she's with us. She has been super instrumental in the progress of a lot of my patients. Now, Teacher Maryann is also a certified massage therapist. She's a certified pediatric kinesio taping practitioner. And she's done a lot of courses on neurodevelopmental treatment as continuing educational programs. And she is the leader and founder of a program in MedMom that we call Life. It's where they advocate for learning through fitness in all children, basically. So, hi, Teacher Maryann. Good
Hi,
morning.
Doc Kay. Thank you for the very kind introduction, and good morning, everyone, and thank you for joining us.
All right. So just a reminder to everyone who is with us, just a check on your dashboard. So you have a Q&A box, you have a chat box. So you can, just type in your comments and we will be entertaining all questions at the end of our lecture. So we just for this particular episode, we want you to have your mat ready. Your mat is very important, and to get your water bottles ready. So just in case your connection is sketchy, just turn off, just log out, and then just log back in. And whatever happens today, we will continue on with the lecture. For our outline, we are going to tackle 4 main points. We're going to go through how the musculoskeletal system of children with Down syndrome is different. We are going to go into the issues of why physical activity is even an issue for them. We are going to teach you core strengthening exercises and why the core is really important for these children. And of course, we want this morning where we will all move. So we want you to move. For those of you who joined this morning and you're just curious but you still don't have an idea on what Down syndrome is, let me give you a brief background. So Down syndrome, it's a genetic condition wherein they have an extra genetic material on their chromosome 21. That's why it's called trisomy, no? Tatlo. So we normally have 22 pairs of chromosomes for these children. Their chromosome number 1 has an extra number 3. And because of that extra genetic material, they usually come with a host of different conditions that you typically see in these children. And this is also the reason why they have their typical features. But for today, we are going to focus on the musculoskeletal system. So I will pass it on over to you, Teacher Maryann.
Thank you, Doc Kay. So yes, looking at some of the musculoskeletal challenges in children and people with Down syndrome, very common characteristics is low muscle tone or hypotonia and joint and ligament laxity, and it can manifest in different ways. Early in childhood, we can see a delay in milestones, so it just takes a little bit more time to reach motor goals such as crawling, rolling, sitting. And as the demand gets a little bit more complex, such as standing and into walking, the time of delay can be a little bit longer. In the feet, it's very common to see what we call pes planus or flat feet, in which there is no arch and the feet kind of go inward. And so this can cause sometimes callus formation, ligament injury, bone spurs, but most importantly, it causes some alignment issues through the foot and the ankle, which in turn will cause alignment issues up through the knee and the hip and upwards towards the trunk. In the hip, because we see some ligament laxity and low tone, we see a lot of mobility or hypermobility in their hip joint. This could lead to instability. It also can progress into subluxation or even dislocation. Um, and so sometimes our kids, we see that they have a leg length discrepancy or where one leg is a little bit, appears a little bit shorter than the other and can cause them to limp when walking. Um, so these alignment issues and sometimes muscle weakness and muscle imbalances can cause a curvature or asymmetry in the trunk, which can put them at risk for developing scoliosis. Children with Down syndrome are also at risk for inflammatory arthritis.
Okay. So that's very interesting, Teacher Marianne. I was just wondering, you mentioned alignment, and I hear that word a lot. What do you mean when you say alignment, and why is that important?
The term alignment is just a way of saying how our bones and joints and limbs are positioned when we're doing certain movements. So optimal alignment will have our bones and limbs and skeletal structure in proper posture so that where our body can move in the most efficient way and our muscles are balanced. And it's also to prevent any sort of injury or strain and stress in our joints.
So mas aligned ka, mas straight ka, mas efficient yung movements mo. It's something like that, no? I'm just curious about flat feet, no? How can that be a problem? How is flat feet usually a problem in terms of movement?
Well, if they have flat feet, sometimes you'll see our kids are putting most of their pressure and weight on the inner part of their foot. And so the latter part is not, sometimes not even touching the ground. So it will affect their ability to stand independently or delay their ability to stand independently and reach those motor goals. But also, like I said, it really will affect their overall alignment and movement. So it's important that we help address this and also correct it.
Okay. All right. So, physical activity in children with Down syndrome. I was just wondering, why is it even an issue, and how different are they from the rest of us?
Yes, looking at physical activity, studies have shown that looking at aerobic and exercise capacity, that their VO2 max, or what we call VO2 max, which is the max oxygen consumption someone gets when doing an exercise, is about half of the typical developing population. And then their max heart rate during exercise is about 8 to 30% lower than the typical population. So they really have difficulty and challenges, performing exercises that will help them maintain their ability to do work, school, recreation activities, and even activities of daily living. Um, it shows that their fitness level is similar to that of a sedentary lifestyle. So it puts them at risk for obesity and being overweight. Uh, we find that they're not performing and doing the recommended daily dose of activity for their age group. So studies have also shown that as they get into adulthood and adolescence, the physical activity decreases and their sedentary lifestyle increases.
Hmm. That's very interesting. So, because they don't utilize oxygen that well compared to us. So even their structured physical programs are, I would presume, are different, no? Okay, so it says on this slide that there are barriers to physical activity. Can we talk more on that?
Sure. So outside of the musculoskeletal challenges we saw earlier and some of their exercise capacities, just some other barriers to think about in the physical environment, and this also applies to many of our children. There's not safe sidewalks or safe outdoor space. The parks aren't that accessible. And even right now with our current situation, it's not safe to be outside and be with other people. As for interest, there's not a lot, or there's just a few available programs and activities that promote physical activity for the Down syndrome population. And psychological, there's a lack of confidence sometimes we see in our children.
Okay. So that lack of confidence, they probably feel, that because they don't know their bodies that well. I wonder, how can we motivate these children to actually exercise?
Sure. Yes, so there's, on the other hand, a lot of people and ways and programs that can help promote physical activity and movement. One of the biggest ways is family. Our family, if we can understand the benefits of physical activity and also be physically active ourselves, then it really encourages them to want to participate and be active with us. Social interaction, I mean, when you do things with friends or with peers, you definitely participate more, and it's a sense of well-being and socialization. Um, and also having structured programs such as physical therapy or other programs that are out there can really help give them the physical skills they need and confidence they need to want to exercise and participate.
All right. It says on this slide that structured, accessible programs. How important are, physical therapy programs in early intervention for these kids? And why do we even need, these structured programs? Hindi ba pwedeng they just go to the gym when,
Right. It's very important to have therapists, physical therapists, occupational therapists, trained professionals that understand all the conditions and challenges. Also, their cognitive capabilities, exercise capabilities, any precautions medically or otherwise, so that we can really make specific and individualized programs that can target the goals and needs of the Down syndrome population.
wow, that's interesting. Teacher Maryann, so we have here, we have parents of children with Down syndrome here with us. Welcome po. We're happy that you're here. So we're wondering, we want to ask you, what specific barriers have you encountered in terms of, physical activity? Ano po yung barriers na nahirapan kayo para mag-exercise sila? Can you type your barriers in our chat? So gusto po namin malaman. Kasi if you read articles from other countries, yung common barriers yon, walang serbisyo, o kaya hindi motivated yung mga bata. Dito sa atin sa Pilipinas, ano po yung mga naging barrier ninyo? So type niyo lang po dun sa chat box. So let's wait for their answers. Okay, let's see. So, all right. So they're still thinking. Okay, so just type it in when you have the time, and we'll move on for now. Okay, so I see here a lot of medical conditions that come about if they don't get enough physical activity. I guess it's the same for us also, 'di ba? Pag hindi tayo nag-exercise, then we get higher risk of heart disease, etc. But how are children with Down syndrome different in terms of consequences of physical activity?
Yes, children with Down syndrome and adults can be more at risk for certain things. So, without physical activity, we can see a lower in bone mass that can lead to osteoporosis even earlier in life. Like we mentioned earlier, sedentary lifestyle type fitness level can lead to obesity, which then can cause heart issues and type 2 diabetes. But other than the medical aspect, I think one of the biggest things is if we don't maintain the skills we learned and the muscle strength and things we gained, basically, if we don't use it, we lose it. And that will lead to a loss of function, loss of independence, loss of confidence, and ability to do things. And then the more they stay physically inactive, and the kind of cycle continues, which can also lead to some mental health issues such as depression.
Teacher Maryann, how is movement related to being independent? Because I'm a developmental pediatrician, my goal is always to teach these children to be independent throughout their lives. How can movement help with that independence?
Well, just with the physical part, like we said earlier, you need enough extra oxygen capacity to be able to do your activities of daily living. I mean, you need good strength and flexibility to be able to go up and down the stairs, pick up your toys, walk around school, keep up with your peers, and also just having, body awareness and confidence in your own abilities and self.
Yeah, that's right. And I think that's really, really important to know. As a physical therapist, I mean, you've been doing this since 2010. How is there really, a big improvement if they start early, and what are these improvements?
Yes, there are a lot of improvements, and the earlier you start, the better, especially in the most critical years of development early in life. But we've seen benefits across different areas. Just to name a few, the opposite end, you can increase bone density and bone mass. In the aerobic capacity, you can improve heart health and their oxygen consumption and heart rate, as well as helping them maintain a healthy body weight. We can improve their strength, balance, coordination, agility, and even into ball skills. And then functional ability, like we mentioned earlier, it'll help with their self-confidence, independence, social ability. It's also shown to help improve sleep, attention, academic performance. So it's in all different areas.
Wow. I guess in addition to that, Teacher Maryann, a lot of articles would highlight improved functional ability as one of the most important benefits of of exercises for the Down syndrome population, no?
Yes.
More than medical, sabi nila, it really helps them become more independent. And diba, Teacher Maryann, I guess that highlights the importance na ang movement, siya talaga yung basis, one of the basis for learning.
Yes.
Speaking of that, I get patients na yes, they go to the physical therapist early, they get early intervention early, but then they stop midway. Sasabihin nila sa akin, Doc, naglalakad na naman stinap ko na.
Mm.
Well, how do you think we should address that?
Yes, that's very common to see. But if we look at the physical activity that you want to see in your child to carry over to adulthood, we have to look also at the fundamental movement skills. The fundamental movement or motor skills are the basis for all physical activity and considered a prerequisite for more advanced motor skills needed for leisure and recreation and sports participation. So if you look on the screen, they cover these three main areas. So with your body, you have your, balance, coordination, agility, but also moving into locomotor skills, and then object control and ball skills. These are all very important if you want to stay physically active and participate past walking into adolescence.
So when we teach, like for example, me, if I teach parents on what exercises to teach their kids, I should tell them that they should hit all three, right?
Yes.
Okay.
We usually see in the population that they have a delay or difficulty performing these tasks or having these fundamental movement skills. But if we can really help them with this and give them the skills, then the more they can and want to stay physically active through childhood and teenage years into adult life.
All right. Now, what about studies in the Philippines? So it's amazing how a lot of studies on the Down syndrome population have been done in our country. Can you tell us more about that?
Yes, as I mentioned a little bit, in this study in particular, they saw that they looked really more at the um, school age, so 6 and older, and they saw that across the board they had delays and difficulty doing these skills, especially the ball skills of catching and throwing and hitting, or they had more of a very immature movement with those skills compared to their peers.
Okay, so hindi lang pala dapat maglakad. Kulang pa yon. So dapat maturo natin itong lahat. All right. Now, you mentioned earlier about the specific weaknesses of children with Down syndrome. Aside from the fundamental movement skills, what are extra exercises that we should be focusing on?
Yes, to make an effective exercise program, as you see on the screen, it should be enjoyable and motivating for them. Otherwise, they won't participate. But if you look at the different areas, we mentioned that they have muscle weakness, some ligament laxity, and hypotonia. So strength training is good to incorporate in their exercise program. And then mentioning some of their aerobic capacity challenges and risk for heart disease and obesity, we should definitely include different ways of getting the heart rate moving, walking, jumping, biking, swimming, playing tag with their friends or siblings, relay racing, anything to get that heart moving. And then if you notice more difficulties with balance or coordination, flexibility, we can do some activities that work on that, such as yoga, martial arts, gymnastics, and dance. It's really what they need and what they're interested in.
So yung interest, no? I think I'd like to highlight that, Teacher Maryann, what they are interested in. So the more exposure they get, then the more we find out what they're interested in, right?
Yeah.
Okay. What are some precautions that our parents in the audience should be mindful of in terms of sports and exercise?
So they're just to name a few. Uh, So in the neck, it's very common to look at what they call axial instability, AA instability. This is between vertebrae C1 and C2. They're held together by many ligaments, and because we know that in this population there's ligament laxity, sometimes it can lead to instability between those joints and even um, possible neurological symptoms. But it's just something to be aware of. It's actually very rare to have AA instability with neurological symptoms. But just to have some screening or just to check, and if you have AA instability, you probably need or most certainly need a clearance from a doctor before performing any contact sports, things like that. And it is noted that trampolining or those heavy bounce houses should not be done with children under the age of 6.
Okay. Yes, I'd like to add to that, Teacher Maryann. So some signs of atlantoaxial instability would be neck pain, problems with walking, what we call gait problems, no? So yon, we have to be mindful of that. And a huge percentage of them are asymptomatic. So when you go on pediatric visits, it's one of the things that the doctor should really be checking. And as you said, vision is really important, no? Kaya dapat na-check talaga yung mata nila. Okay. Before we go to core strength, Teacher Maryann, I'd like to segue into a question we have on our chat box. So one of our audience asked, how do you maintain their body alignment? Because in therapy sessions, therapists would try to facilitate the alignment, but it keeps going back to how it used to be. How do we maintain the alignment?
To maintain alignment requires a lot of core strength and strengthening of the muscles to support the joints and the ligaments. um, so if we look into the core, what the core is, a lot of us think the core is just your abs or the tummy muscles in the front, your six pack, or they say, but actually the core is your whole midsection. It's very important, and the muscles are all around. If you look at your core as a box, um, in the front we have your abdominals, and then on your side you have your obliques and transverse abdominis, and in your back you have your spinal muscles and your muscles in your butt. And then on the roof of the core you have your diaphragm muscles, and on the floor you have your pelvic floor muscles. So there's lots that are involved, and the core is so important for alignment, stability, and movement of the trunk. I like to see it that the core is basically the foundation for all gross motor and fine motor skills. With a weak core, you have poor posture and poor alignment, and difficulty moving optimally. And you also have difficulty doing things with your upper extremities, even with your neck and head, and coordination and things like that.
So I guess, Teacher Maryann, um, in connection to that question, yung alignment natin, is it something that we need to practice, or is it just something that develops naturally in kids with Down syndrome? I mean, is it something that we need to work on, or magde-develop na lang ba siya mag-isa?
Usually with children in Down syndrome, because again of some of the musculoskeletal issues and the low tone and laxity, we really need to work on it early in life to teach them how to coordinate their muscles, how to work on posture, how to give them the proper alignment. Sometimes they, because of their weaknesses or low tone, they learn compensatory ways to do things, which isn't always good for their alignment and posture, and can become habitual later in life.
Okay, so there's a question here. If we have to work on these core muscles and the alignment, how do we work on that? So I think you have a slide for that here, Teacher Maryann. Uh,
Uh,
First, what are the signs of a weak core?
yes, there are signs we see a lot in our children or even in ourselves, the slouching or slumping in the chair, or when you're sitting on the floor. When they're doing tabletop tasks, as you see on the screen, they'll put their head down, or they'll lean on their arm or on someone. A W sitting is very common to see because in this position, they have a very wide base of support, so their core doesn't really need to work to be stable. Some attention difficulties or being able to perform tasks, balance issues. So we're going to see some trips and falls or clumsiness, and then even some feeding and swallowing difficulties.
So teach, I'll go to W sitting. No, I see a lot of kids in the clinic who are W sitting, and some parents think it's normal. You read articles online and they say na, oh, at an earlier age pwede pa yan, it's normal. What's the truth behind W sitting?
I personally wouldn't suggest it at any age, especially in this population because of the, as we mentioned earlier, the joint laxity and hip instability. I mean, this position puts the hip joint and the knee joint on a lot of strain and stress, and poor positioning, and also will cause muscle imbalance in the hip muscles. So some will get overly tight and some overly weak. And into standing and walking, sometimes they have some in-toeing or pigeon toe walking. So it will affect also their balance and walking and into gross motor skills. So it's important that we correct this as early as possible, or give them also that core strength so that they don't want to sit in this position or don't need to.
So if I see my child in a W sitting position, what do I do? Do I correct it? How do I correct it?
Yes, as we're still working on giving them that strength and ability, we can just remind them. Sometimes it has become habitual. So just to prompt them, sometimes we tell our kids, fix your legs, sit crisscross, and they're usually good about correcting it. So trying to change that habit.
All right. I'm a huge advocate of feeding. That's why I'm going to ask this. So how is core strength important in feeding?
So as we can see, if you have a weak core, you have poor sitting posture, as in slouching. So if you have that slouched posture, your head is forward and neck is forward, your shoulders are rounded. So if our neck and jaw muscles and mouth muscles are not in optimal position, they're either over lengthened and weak or shortened and weak, then the muscles of the jaw for chewing and coordination of the mouth isn't there, and it's difficult to do that. And then as you can see, if your neck is not in the proper position, then swallowing can also be a challenge.
All right. What about slouching? What advice can I give parents about slouching?
For slouching, as we're again working on their strength and core, but other things is to look at the seating, how they're sitting, if their feet are flat on the floor, maybe put a table in front so they can put their hands on something, or if you see them. But actually, Teacher Hosanna, next Monday we'll be talking a lot about posture and sitting and proper alignment and how to work on that.
All right. Now, just the last one because this is surprising. Attention difficulties. How is that correlated to the core?
Well, just for one, like I said, the core is important for all fine motor and gross motor skills. So if you have them do a task that they aren't able to do because of their weak core, they may just be disinterested and not pay attention. And if sitting in those poor positions is uncomfortable, they also will lose focus and attention.
All right. Okay. We're all stuck in quarantine and with nothing to do for a lot of us. So, can you teach some, chores that can strengthen our core while at home?
Sure, it's good to get your kids involved in some daily activities such as house chores. Just to give an example, here are some things that you can do at home. So you can have them help reach up and wipe the windows or dust the windows and then squat down and help wipe something lower on the ground. Making your bed is good for core. Sweeping, helping sweep the floor. You can work on putting away clothes and laundry or packing away your toys, putting things away, carrying things from one place of your house to the other, up and down the stairs is very good for your core. And you can be creative if you want them to sweep something or clean something, putting them in a position where they really have to work their muscles.
I guess,
But it
go ahead.
but it's not just inside the house. I mean, you can get creative. They can be outside, helping you in the garden, watering plants, pulling weeds, washing the car. I mean, it's very meaningful when they feel needed and also to help you with these daily activities.
Well, I guess what you're saying here that any type of movement can actually improve the core. I mean,
Yes.
I'm thinking, how can sweeping improve the core?
Uh, well, like I said, your core is involved in all your trunk and extremity movement. So when you're sweeping, you really have to rotate, do some of the rotational movement from one side to the body, as well as just balancing and being upright. In making your bed, I mean, especially if the blanket's a little bit heavy, you have to really flex and extend your body and do some rotation, which all involves core control and strength.
All right. Okay. So, I think you prepared some exercises for us to follow this morning.
Yeah, so let's get ready to move our bodies. These exercises help really focus on the core activities, but they also work on a lot of other things, a lot of strengthening of other muscles, as well as integration, reflex integration, and coordination. So if your child is not sitting with you, listening to the lecture, I recommend you go get them and have them join with you. I think it'll be fun if we do it all together.
All right. So, everyone watching, get your mats. We are all going to follow the demo exercise. All right. Get ready.
All right, now I'm going to demo some exercise to help work on your core, but also other muscles of the body. So all you need is your mat and come and follow along with me. The first exercise we're going to do is Superman. Superman helps work your back, your bottom, your core, and your hamstrings. So with this exercise, you start by laying on your stomach, arms out in front of you, and then you're going to lift your head and chest off the ground. And then your arms up off the ground, and then your legs, including your thighs. Hold it up like this. Great. If that's a little bit challenging for you, a way to make it easier is to just lift your head and chest off the ground and your arms, but leaving your legs on the ground. Great. Next exercise, we're just going to roll over onto our back, outstretched.
This exercise is called popcorn. This exercise, you're going to work your core, your arms, your bottom, and your neck and shoulders. So this one, you bring your knees up towards your chest, hug your legs, and then bring your head up towards your knees. Hold it right here. And then pop open. To make that a little bit easier, if it's a little bit challenging for you, we can just bring our knees towards our chest, hug our legs, but leave your head and neck down. Or you can have someone help support your head and neck in lifting it up. Okay, great. Next exercise is bridge. Bridge, we're going to stay in the same position, laying on our backs on the mat, but we're going to have our knees up and feet on the floor. This exercise helps work your core, your bottom, your hamstrings, and your lower back. So in this exercise, you're just going to bring your hips toward the ceiling, pushing down through your feet. Bring them up as high as you can. And hold. All right, if that's a little bit challenging for you, just try to come up as high as you can, getting your bottom off the floor, or you can have someone help support your hips in lifting it up. Great. Next exercise, we're going to stand up, shoulders back. This one is standing marching in place, or elephant stomp if you want some kid-friendly terms. For this one, works your core, your legs, your hips, and if you add in your arms, then also your arms. So this one, you're just going to stand, march in place, try to bring your knees up high past your hips, towards your chest. If balance is a little bit difficult for you, you can lean on someone or on the wall. Do the same thing. With this, we can also add the arms, touching opposite knee. Or to make it even more challenging, bring your elbow to opposite knee. Great. The next exercise we call inchworm. This exercise is a great exercise to work out your whole body. Works out your arms, your shoulders, your chest, your core, your back, and your legs. With this one, you're going to stand with your feet shoulder width apart. Your feet are not going to move. Your hands come down onto the mat, bending at your knees. Then you're going to slowly walk your hands away from your feet until your back is straight. And then walk your hands back. If that's a little bit challenging for you, just walk out as far as you can. Even if it's just halfway, and then walk your hands back. Great. The last exercise is bear crawl. So this one is similar to the inchworm as it works all the muscles in your body, from your arms, your shoulders, your chest, your core, your bottom, your legs. This one also helps with some coordination as you have to move. So starting position is the same as the inchworm. Feet shoulder width apart, hands come down onto the floor, knees slightly bent, and then you're going to walk forward with your left hand, then your right foot, right hand and left foot, and continue this, keeping your hips in the air, and then we're going to go backwards. That's a little bit challenging for you. You can try to go down on your knees. Then we're just going to crawl forward, creep forward on our hands and knees, and come back. And there you go.
All right. Ooh. Ooh, that was That was tiring, even if that was just a demo, Teacher Maryann. And I noticed parang for each exercise, like you're really hitting everything, and it's not just the core, right?
Yes.
That's
Uh,
amazing.
you're working all different muscles with just one or two exercises.
Amazing. And I also noticed that when you do the inchworm and the bear crawl or the stomp, like it helps you make it helps you feel calmer, you know.
Yes, those exercises we call sometimes heavy work, where they really give input through the joints and the muscles. And that type of we call proprioceptive input, it can be calming and help regulate also.
Well, when you say proprioceptive, what exactly do you mean by that?
Proprioceptive is more meaning a body sense. It's your body awareness. So, for example, without looking at my foot, I know that I'm moving it down and up just by feeling it. So some of our kids have difficulty with that, difficulty with body awareness. So these type of heavy work exercise can help improve that.
All right. Okay. So what are the recommendations for children with Down syndrome? How active should they be?
Actually, the recommended daily amount of physical activity per age group is the same as the guidelines set up for all children and adults. It is no different. So we recommend they do at least the minimum, if not more. Um, so to give a sample schedule, depending on the age group, again, you can mix and match or just change it depending on your child's interest and how your day is. But we can start, if you look at the screen, with infants. They need at least 30 minutes to 60. A lot of this can be done in what we call floor time. So if you have a mat or safe space on the floor, putting them on their tummy, on their back, where they really explore their body and how to move, learn some rolling or pushing up on arms. It's actually a lot of physical work and activity. So really getting them that open space to move their body. In the toddler preschool age, they need the most recommended time of at least 3 hours a day. So again, this can be done in different ways, as we said earlier, in helping around with chores around the house, adding some locomotor tasks. But I read that one of the comments was it's hard to keep the kids engaged. Sometimes they just run away, especially with these formal type exercises. Well, one way, even if you're trying to do a bridge or Superman, you can make it fun and engaging. For example, with the bear crawl, sometimes I have it as a relay race, or I have them go get a puzzle in bear crawl and then bring it back doing lizard crawl. Or with their holding the bridge, you can pretend to have their toy cars or animals go underneath them and tell them, hold it up as long as you can, don't crush the animals. Superman, you can pretend they're flying or having them put something into something. But also just fun games, Twister, freeze dance, tag, rolling, tumbling, obstacle courses, just getting creative with it. Anything that is fun and has movement is good for this age. Now for the school age and adolescence and into adulthood, at least 60 minutes, if not more. So they could have a schedule for their day where in the morning they can do some sort of formal exercise program. There's a lot on YouTube. You can follow some HIIT exercises, some stretching regimes. Midday, they can do some work, vocational work, chores, um, things that have sort of movement in it. And then you can end the day with some yoga strengthening exercises or cool down stretches, things like that. So you can vary it how it works for your child or for your family, but really just trying to think of ways to incorporate movement in your day versus more of the sedentary activity.
Yeah, so as they say, something is better than none. And just a reminder again for the infants, so you only do the tummy time when they are awake and they are supervised, no? So you don't put them on their tummies, especially in the first 6 months to the first year of life because of the danger of sudden infant death syndrome. And this is just a sample schedule, right? They can divide it in whatever way they want. All right. So I guess that ends our overview on Down syndrome, exercises for Down syndrome. Now, we invite you to do the whole set with us. So let's stand up again and let's get our mats and let's get ready to move. So
Sorry.
Teach, do you have instructions for this particular one?
Yes, we're just going to do a set of the exercise we demoed earlier. I will start each exercise showing the easier way if you choose to do it that way, but we'll do all the reps and counts holding it the intermediate way. The reps and counts are on the screen, but I will also be counting out loud for you. Add a little bit of music for some fun. So if your kids ran away, please bring them back and hopefully they'll do this with you.
All right, let's move. Get your mats.
All right, we're gonna do a set of the exercises I demoed earlier. Before each exercise, I'm going to show again the easier way in case you choose to do it that way. But we're gonna do all reps and counts the more difficult way. So if you're all ready, let's get on the mat and let's get started. So we're gonna start out with Superman. Easier way, head and chest off the ground, and then your arms. But leaving your legs down. Hold it this way. Alright, more difficult way, we're going to do legs up and arms as well. 2 times, 10-second hold. And let's go in 3, 2, 1, and up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And rest. One more time, up again in 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great job. Now onto our back for popcorn. Again, the easier way, you just bring your knees up, hugging your legs, leaving your head and neck down. More difficult way, bring your head up to your knees. You're gonna hold for 5 seconds, 3 times. All right, and 3, 2, 1. Up. 1, 2, 3, 4, 5, and pop open. Again. Up. 1, 2, 3, 4, 5. Pop open. One more time. Okay, in. 1, 2, 3, 4, 5. Right, next one, bridge. Easier way. Just come up as high as you can, getting your bottom off the ground, or you can have someone help and support your hips and bring them all the way up. Alright, we're going to go up and down 10 times. And then on the 10th one, hold it for 10 seconds. Alright, and 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And we're going to hold it here 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. Now we're going to come up to standing for our standing marching in place. Again, the easier way if you have a little bit difficulty with balance. You go on the wall or go onto someone. Bring your knees up. You can also bring your hand to the opposite knee. There we go. I'm going to do elbow to opposite knee, 15 counts. Let's go in 3, 2, 1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Great. Now on to inchworms. Again, the easier way, you can just walk out as far as you can, halfway, and then come back. Or you can just hold this down dog type position if it's hard for you to walk your hands out. Okay, the more difficult way, we're gonna walk our bodies out all the way straight. 5 times. Get ready? In 3, 2, 1. Let's go. Hold and back and out again. 3, 4, last one, 5. Alright. Now, last exercise, bear crawl. Again, the easier way. Just go on your hands and knees. And back. More difficult way with your hips up in the air. We're going to do 2 laps, forward and back. Okay, get ready. 3, 2, 1. And back. One more time. All right, you're all done. Great job.
All right. Woo. Okay. Wow, that was a workout. That was a great work, Teacher Maryann. Now, I'd like to everyone who is with us this morning, how are you feeling? And was that easy for you? Was that hard? If your kids joined you this morning, were they able to follow? So just type in your comments on our chat box. Hey, while we are waiting for their comment,
All right, we're gonna do a.
we are going to open the floor for some questions that you may have. So, Teacher Maryann, ipahabol ko lang, there was a question earlier on flat feet, no? So, the first question is that the flat feet of children with Down syndrome, is that the same problem if you're typically developing and you have flat feet?
Yes, with flat feet, we sometimes have to look at the cause just to make sure we're addressing the source of the problem. But a lot of times for our other children, it also can be due to low tone and weakness. So similar concern.
All right. Okay, so type your comments in, type in your questions. Does anyone have a question? All right. So I guess I'll ask the first question, Teacher Maryann. So there's a lot of questions about alignment. Aside from the core exercises that you taught us, anything else that you'd like to add to that on how they can fix, straightening up? Although we will be talking about posture and alignment for episode 4, which is next Monday. So if you want to join us for that. So, but
Sure, yes, other ways other than strengthening, since that may take some time to do immediate fixes. Like I said, we can look at the position of the chair. So our pelvis has a lot to do with the way our trunk sits. So if your pelvis is tilted more towards the front, helps extend your trunk, and if it's tilted towards the back, it leads to some flexion. So if you have a chair where the seat is flat or slanted, maybe you want to add a little bit more cushion towards the rear to help assist with being more upright and make sure their feet are flat on a surface or on the floor and not just dangling, things like that. So we can just look at the environment and how we can change that to help improve their alignment and posture if yet their core is still weak and we're still working on those.
in actual therapy, are there assistive devices that you use to help with, alignment or in strengthening the core?
Assistive devices, not specifically. We use a lot with our hands and teaching and prompting. guiding. But if we're doing certain sessions, like for the occupational therapist, they use some adaptive seating devices sometimes to help support proper posture when they're working on tabletop tasks or feeding, especially.
All right. Okay, so thanks for that, Teacher Maryann. Any other questions from all of you out there? So how long do these children improve, teach? Sa experience mo, how long does it take?
It's hard to say exactly a specific timeline. It also will depend on how many times we see them in the clinic and what they're doing at home and their whole program and follow through. So the more consistency, then the faster the improvement. And also, if we see them earlier in their childhood, during those critical years, sometimes we can prevent some of those compensatory and help make the delays a little bit less. But most of the time we find our kids really improving in all areas. They may come in having not walking at all or having still an immature gait pattern. And then after working with them consistently for a few weeks to uh, months, then we start seeing them running or climbing, happier affect, really wanting to exercise and participate and starting to do things more on their own without us prompting them or telling them what to do. They'll just come into the gym and start going towards the ladders, things like that, or grabbing the balls, a lot more active.
All right. I guess there's a question on activities. Do you have activities available for this quarantine period that could help our children? And if you have activities post-quarantine?
Yes, right now it's hard because I know we're all at home, but you're welcome to reach out to us in a telehealth or teleconsult, and we can really see what's happening in your home and what challenges you have or things you really want to work on and make individualized programs, teach you how to help your kids at home as well, and hopefully move with your kids. But if we can get back in the clinic, there also are individualized sessions, but also we have group programs like mentioned earlier. There's Life Fitness for the older age and Move to Learn to Move for the younger age. There's various programs that are available to really help work on what your children need.
All right. Okay, so that was a very informative lecture, Teacher Maryann, and thank you very much, for being with us this morning. I
Uh,
would like to invite the rest of you to be with us again next Monday, because next Monday we will be talking about posture and alignment and why it's important for our children. So, any last words, Teacher Maryann, before we close today's session?
just want to thank you for joining us this morning, especially being up early on Monday. But just take home note, just be active and stay active and move your bodies. So thank you.
Bodies, that's correct. All right, so goodbye, everyone, and thank you again. See you next Monday. Bye bye.
Bye bye.